Mental health care in Canada is decent, but still lacking. Long wait times and lack of services are glaringly obvious issues surrounding mental health care in the nation. In a recently produced article, it was found that mental health accounts for only 7% of Canada's healthcare budget. The cost of mental illness to the Canadian economy in terms of healthcare and lost productivity is estimated to be $51 billion a year. A study published earlier this year tells us that 65% of Canadians who've experienced episodes of psychological distress in the past month have not spoken to a healthcare professional about this issue. So how can we improve mental health in Canada? Well, for starters, we need more funding, more facilities, and more accessibility. What are the steps we are going to take to achieve this? Well, we have protests and demonstrations, awareness building, stigma reduction, open communication channels throughout society, and political acknowledgement and involvement. Much of the success in the mental health community in Canada has been achieved through initiatives to build awareness. Some examples are the Bell Let's Talk program, which is an initiative to promote mental health education, research, awareness, and reduction in social stigma. This program is most known for its annual Let's Talk Day and the associated charity fundraiser. Another example is the Light Up Purple for World Mental Health Day, which is held on October 10th and is intended to drive the global mental health awareness, education, and advocacy. Light Up Purple is an initiative of the Amanda Todd Legacy Society, which was founded by Amanda Todd's mother. So, what have these movements accomplished? These demonstrations have pulled mental health issues out into the light and created conversations that highlight how common mental illness is and have created a powerful social movement regarding the matter. Social media plays an important role in these accomplishments as well because it has created a truly accessible platform that stretches across the globe. In the past, mental health problems have been severely stigmatized and taboo, so it is truly inspirational to see this shift in attitudes. There is now more government support for mental health than ever before. For Mental Health Week, Prime Minister Justin Trudeau encouraged citizens to raise awareness about mental health, which he considers an important but sometimes invisible aspect of our general health. Working directly with the Canadian Mental Health Association, the Government of Canada stated it will provide $5 billion over the next 10 years to the provinces and territories to support mental health initiatives. Although this is great headway for mental health, it is still such a small amount of funding to put towards. So how do we get more money? With the legalization of marijuana coming up, it is projected that marijuana sales will roughly bring in $1.6 to $2.3 billion annually in the province of Ontario. If we apply this just to British Columbia and utilize the fact that the government plans to let the provinces keep 75% of revenue, that will bring in roughly $1 billion into the pocket of mental health services in British Columbia. And also take into account that international students coming to study in BC contribute $130 million province-wide to the public system. This money needn't leave the education system. This money can stay within the education system, but have some of it go towards improving mental health strategies for young adults in college and university.